Good afternoon, everyone. Thank you for joining us today. This is the East Hanover Township School District 2025 Open Enrollment presentation. My name is Elizabeth Roldan, and I'm here from IMAC Insurance. IMAC Insurance is the insurance broker for the district, handling all your medical, prescription, and dental insurance benefits. We're here to answer any questions related to open enrollment, as well as any claim matters. I know that we've talked to quite a few of you throughout the year with any claim issues that you may be experiencing with regards to your medical, dental, or prescription, a prior authorization, or an issue with a prescription that you're trying to get. So feel free to reach out to us. You can call our office at 973-450-9800, or you can send us an email at info@imacagency.com, and we will get back to you. We're very good about making sure that we're getting back to you either within the hour or definitely same day, just because I know that open enrollment is ending May 30th, and we want to make sure that we get you a response as quickly as possible. So definitely feel free to reach out to our office directly. This open enrollment period, which occurs annually, is started on May 7th and is running through Friday, May 30th. So that is the Friday right after Memorial Day. I wouldn't wait till the last minute, though, to ask any questions that you may have or to submit your paperwork, just in case there's anything that needs to be done with regards to that. But open enrollment is your annual opportunity to review your plan options and make any plan changes, add any dependents or anything like that. For those of you that were hired on or after July 1st of 2020, you are required to only be enrolled in the New Jersey Educators Health Plan or the Garden State Health Plan, or you can of course waive your benefits if you have coverage elsewhere. But those two are really the only two plan options for anyone that was hired on or after that July 1st, 2020 date. If you are waiving your coverage, you do need to complete a waiver form, and that's annually. But if you're not making any plan changes, no action really is needed on your behalf unless you are enrolling in flexible spending or dependent child care for the upcoming year. For this 2025 open enrollment, you do have 9 medical plan options through Horizon. You have your direct access plans, your Omnia plan, your point of service plans, and then your Garden State and Educators plan. For the most part, in the district, what I see is your enrollment really mainly focused on either people in Direct 10 or people that are in the New Jersey Educators Health Plan. And those are really the two plans that we're going to be focusing on the most today. But definitely feel free to submit through the chat any questions that you may have with regards to any of the 9 plans that are being offered. On the IMAC benefits portal, which we had at the beginning of the meeting, but we'll show that slide later on as well, we do have the ability for you to do a side-by-side comparison of all 9 plans, just so you can see how they compare to one another with regards to deductibles, copays, hospitalization, and all of those important benefits. One of the questions that we get asked quite frequently is, how is the New Jersey Educators Health Plan or the Garden State Health Plan a savings compared to the other plans? And it really boils down to how the contributions are calculated. So if you are someone who is all the way here on the left that is in the direct access, the Omnia, or the point of service plan, those are calculated at what's called Chapter 78. So the coverage tier, so whether you're covering single, family, 2 adults, parent, and child, your salary, and the premium of the plan are factored into that calculation to determine the percentage that you are contributing towards your health contributions, versus the educators plan or the Garden State Health Plan, which utilizes Chapter 44, and they only calculate the coverage tier and the salary. So the premium of the plan, even though it goes up pretty much every year, is not factored into that calculation, which is why the rates are definitely at a guarantee lesser expense than your other plans. So you definitely will have a savings, but the plans are all different. So part of what we're trying to accomplish here today is to make sure that everybody has a full understanding of what their options are, so they can make a decision as to what plan best meets their medical needs as well as their financial needs. But one of the questions that we get is, if the plan goes up every year, do my contributions change? And the answer is no. Unless your salary or your coverage tier changes, if you're under the educators or the Garden State Health Plan, that's the only way that you would have a change in your contribution. So there's a lot more predictability as to what your contributions are going to be by being in the educators or the Garden State Health Plan. So some of the highlights that we want to focus on with the educators and the Garden State Health Plan compared to your other plans. The Educators Plan and the Garden State Health Plan both utilize the same network of providers that are currently in your Direct Access plan. So if you're in Direct 10 and Direct 15, Direct 1525, etc., all of those providers in the Direct Access plans are in what's called Horizon's Managed Care Network. And that is the same network for the educators and the Garden State Health Plan. So if you're in Direct 10 and you're looking to switch into the educators plan, you do not have to worry that those in-network providers that you're currently seeing are going to be in the same network as far as the educators or the Garden State Health Plan. So no network disruption there. The Garden State Health Plan, however, only offers coverage in the state of New Jersey. So if you are looking to go to providers that are, let's say, in Pennsylvania or New York, the Garden State Health Plan would not offer any coverage outside of the state unless in the case of a true medical emergency. So that is a big takeaway with regards to that plan, because if you have, let's say, a dependent child that maybe is a student outside of the state, they technically will not have coverage if you are in the Garden State Health Plan unless it's a medical emergency. So something to definitely consider. The contributions for the Educators Plan and the Garden State Health Plan are calculated, as we mentioned, as a percentage of salary rather than a percentage of the premium. And for the Garden State Health Plan, those contributions are half of the percentages used for the New Jersey Educators Health Plan. Both plans offer a $10 copay for your primary care physician, $15 copay at your specialist, $125 emergency room copay, which is waived if you're admitted in the hospital. Under the Educators Plan and the Garden State Health Plan, that's a little typo we have there, but under both of those plans, you do have the gym reimbursement available, and your out-of-pocket costs may be higher if you see out-of-network providers, which we are going to get into a good amount of detail coming up. So when we talk about out-of-network under the Educators or the Garden State Health Plan, it's very specific. So when you go to an in-network provider, that provider has a contract with Horizon, and they cannot bill you anything above that contractually obligated copay. But when you go out of network, that doctor can really bill whatever they want. And the insurance company reviews what the doctor bills and determines what is usual, customary, and reasonable to determine what to reimburse for that provider. They use a completely different table than under your direct access plans. And I can tell you right now, especially now that the plan's been around for 5 years, that the reimbursement rate to those providers is definitely a lot less than you're currently getting under your direct access 10 and 15, for example. So if you are someone that goes out of network with a certain degree of frequency, whether it's weekly, biweekly, even on a monthly basis, definitely a red flag to consider whether whether you should choose the Educators or the Garden State Health Plan, because the out-of-network reimbursement is definitely a lot less than what you're currently getting. Specific also to the out-of-network, there are 3 services that are capped at specific dollar limits when you go out of network under the Educators or the Garden State Health Plan. So if you go out of network, let's say to an acupuncturist, the Educators and the Garden State Health Plan limit that copay or that coverage up to $60. So anything above that that is billed by that out-of-network provider would be your responsibility as the member to pay that provider to make their bill paid in whole. Same thing with physical therapy, that's capped at $52, and chiropractic is capped at $35. So again, they set very specific dollar limits for these out-of-network services, and the other services, again, are reimbursed utilizing the Medicare table. And just to further explain the out-of-network under the Educators and the Garden State Health Plan, if, for example, you go to an out-of-network provider that here in this green box, they bill $100, that when it is submitted to Horizon, Horizon will determine what that would have been under if the doctor would have been in network. So they determine what the usual, customary, and reasonable, so UCR, they determine what that allowed amount would be for that covered service. Horizon then pays their 70% here in this orange box of towards the co-insurance. You as the member pay your 30% in the purple box here, which would be $15, and this is what accrues towards maximum out of pocket. But this other $50 that is still part of that total bill that the doctor billed for that service, that is what is known as balance billing. You as the member would be responsible for that amount, and this red box here does not get applied towards maximum out of pocket. So even though we're using a very small example with just $100, Usually when you're going out of network, you're most likely seeing a specialist, which is a lot more expensive than this, especially more expensive than a primary care physician. It's important that you understand how out of network functions. You as the member can also be very proactive and ask for a predetermination of services. So you kind of have a ballpark figure if you choose to go out of network of what your out of pocket expenses could potentially be. And you can certainly ask that of that provider. But again, it's important to note that the out of network reimbursement under the educators and the Garden State Health Plan is much less than what you're currently receiving under your direct access plans. And just to compare the top 4 plans all side by side. So as we mentioned, the Horizon Managed Care Network in New Jersey, that is the network that you have under your direct access plans, as well as the educators and Garden State Health Plan. And however, Garden State does only have coverage in the state of New Jersey. So that's important to note. All the plans nationally, with the exception of the Garden State Health Plan, utilize the PPO Blue Cross Blue Shield. So if you look at your Horizon card, you'll see a little briefcase there. That means that you have national coverage with the Blue Card PPO network nationally. But again, Garden State Health Plan only has coverage in New Jersey. And your copays are pretty similar for primary as well as for specialists, so depending on the plan that you choose. And your annual physical is covered in network at no copay at all. For as far as deductibles, none of the plans require an in-network deductible. So the moment the plan starts in network, you have coverage right away. But out of network, you would be subject to your applicable copay, to your applicable deductible, excuse me, depending on the plan that you choose. So for example, if you go out of network under the direct access 10, that's $100 deductible for an individual. Or under the garden or under the educators plan, that's $350 as an individual. That would be your out-of-network deductible. Out-of-pocket max, which is the most that you would lay out in a calendar year, you have different limits for in and out of network. And out of network, as we mentioned in one of the previous slides, the out of network, this, like for example, under the educators plan, this $2,000, this is for anything that is based on usual, customary, and reasonable. But anything that's above that, again, balance billing in that red box, like we talked about, does not get applied towards maximum out of pocket. None of the plans require a referral. Your labs across all plans are Quest and LabCorp in network. And if you go out of network, it is your applicable coinsurance and deductible. Same thing for outpatient surgery, no charge if you stay in network, but out of network, you are subject to your deductible and coinsurance. And the emergency room copay, again, varies depending on the plan that you choose, but not only in the educators and the Garden State Health Plan, but in all the plans, the copay is waived if you're admitted into the hospital. I very much encourage anyone to reach out to us if you have any questions about how you currently utilize your plan, just to see what would work best and talk about your specific situation, just to see if, moving into the educators plan or the Garden State Health Plan makes sense based on how you and or your family utilize your benefits currently. The prescription plan is dependent on the medical plan that you choose. So for any of the other 7 plans that are not educators and not Garden State Health, you have this first column here towards the left with your applicable copay for generic brand and non-preferred brand name drugs. And you have different copays depending on whether you do retail or if you do mail order. But in the educators and the Garden State Health Plan, that same list of drugs that is covered under all the other plans are different. So in the educators and the Garden State Health Plan, it is a smaller list of drugs that are covered with a requirement of mandatory generics. So what I like to explain to people is that while there will always be a drug for every single condition, it may not be the one specifically that you and your doctor want. If your doctor, let's say, writes you out a prescription for Crestor, which is a cholesterol medication, under the educators or the Garden State Health Plan, you would be required to take rosuvastatin, which is the generic version of Crestor. If you did not want to do the generic version and only wanted to do the brand name version, at that point, you as the member would be pretty much responsible for the entire cost of that medication. So again, while you're comparing how you utilize your medical plan as far as in and out of network, it's important to also take a look at how you utilize your prescription plan. If you're someone that can only do brand name drugs and there are lower cost generic options available for that same drug, it's important to note that this may not be the plan for you. There are drugs that are brand name that are covered. So we do have a flyer on that of those excluded drugs on the portal, but certainly feel free to reach out to us and we can reach out and find out what options you have. And you can do the search as well on Horizon's website to see if your drug is covered or not, or if, if it has a lower cost generic option available. Someone is asking in the comments here, my son turned 26. Will he be covered until the end of the year or until June 30th? I'll skip over to that slide real quickly to answer your question. Excuse me, right here. So they do have until the end of the calendar year, so 12/31/25, and we're going to be talking about that in more detail soon, getting to that slide. But good question, and please keep your questions coming. So with that said, that really covers prescription and medical. So really next steps would be if you are looking to make a plan change, you would complete an enrollment form. If you've never enrolled and are looking to enroll for the first time, you would definitely need to include you would definitely need to complete an enrollment form. And if you are waiving coverage, you do need to complete a waiver form. We do have all of the forms on the IMAC benefits portal, as well as plan comparison options that you can do to see which plan works best for you. And we do have the contribution calculator also for the 2025-2026 calendar year on the portal right now. We do have also instructions with a link of how to do a provider search if you're looking to maybe find a provider for the first time, for example. But like I said, the educators and the Garden State Health Plan do utilize the same providers as you have in the direct access plans as well. This is your open enrollment opportunity, and you will not have another one until May of 2026. And any changes that you make this year will be effective as of July 1st. The big takeaway here for today is May 30th. That is the deadline that open enrollment ends. So please make sure that you return your forms to Carrie by that date. Very important.
And let's just say the
yeah.
forms that they have the access to the forms on Frontline.
Perfect. Yes,
that's
even better.
That's our portal. Yeah.
Excellent. And we keep mentioning the IMAC portal. So this is really the information for the portal. If you go to imacbenefits.com and you enter in the guest key, which is EHBOE, all in caps, one word, everything and anything related to open enrollment, everything that we've presented today is also on that portal. So please make sure if you haven't visited it, make sure you do, and you can bookmark it. It's a good reference guide for all your health plan information. And as we said, we do have the new rate sheets on the portal as well. But really what you should be looking at is the calculator. The calculator is perfect because we have it all filled in with your rate information. So as long as you enter in the plan that you want, your salary, and who you're covering, the calculator will perform that calculation and let you know what you'll pay on a per pay as well as an annualized basis. You do need Excel 2013 or later in order to use the calculator. So if you don't have access to Excel, call us or email us. We will run those numbers for you. And we'll let you know what, if you stay in your current plan, what your contributions are going to be versus if, let's say, you switch into the educators or the Garden State Health Plan, for example. And while we understand that this is open enrollment, life happens outside of open enrollment. So you do have 30 days, with the exception of a newborn baby, to complete and submit any enrollment forms and documentation to your Human Resources Office. Coverages are retroactive to the date, so long as you do that within that 30 or 60-day timeline, depending on whether it's a marriage or having a new baby. But for the most part, 30 days for everything with the exception of newborns. Open enrollment, as we said, is your annual opportunity to make any changes, such as changing plans or adding or removing dependents or waiving coverage. And for the person that asked about their child who is aging out, yes, your children are covered until the end of the calendar year in which they turn 26. At the end of that, they do have several options available to them, which include COBRA, Chapter 375, or there is, if you have a special needs child, there is coverage continuation for overage children with disabilities. We do have that form for the continuation of coverage for overage dependents with disabilities on the portal. We can certainly walk you through it if you have any questions about how to get that completed. And Chapter 78, Chapter 375, excuse me, which we will get into here, is a New Jersey state mandate that so long as your child is unmarried, under the age of 31, have no dependent children of their own, either live in the state of New Jersey or are a full-time student outside of the state, and are not eligible for any other group coverage or entitled to Medicare or Medicaid, they can go ahead and enroll into the same plan that you have now for medical and prescription. We mentioned Chapter 375 or Dependent 31 as it's also known, because it is a much less expensive option than COBRA. It is about 67% of the single rate of the current plan that you're in. You and your dependent child would be responsible on a direct pay basis with Horizon. So if this is something that is applicable to you, I would encourage you, if your child is aging out towards the end of the year, to go ahead and in November really start looking into this, submitting your forms, so Horizon can get you set up for coverages to begin as of January 1st. We do have the form also on the IMAC portal, but reach out to us with any questions that you may have as well. And as I said, we do have the Horizon Doctor Hospital Finder link on the IMAC benefits portal. But really, if you go to horizonblue.com/Doctor Finder, you can also perform the search for yourself directly. Horizon BFit is a gym reimbursement, if you will, that Horizon offers for all of the plans, which is a $20 reimbursement per month if you go to a gym 12 times or more a month, or if you complete your 10,000 steps a day, which most of you probably do anyway. So important that if you haven't signed up for it, check out Horizon BFit. Horizon Blue 365 is Horizon's discount program for all of its members. So if you go to horizonblue365deals.com, you can go ahead and register for weekly emails on discounts such as sneakers, meal plans, gyms, and including even LASIK eye surgery. Horizon also has an app as well. So if you go to horizonblue.com or in the app store of your phone, whether you have an Android or an iOS phone, you can certainly download Horizon's app to go ahead and review not only your explanation of benefits and anything related to your coverages. I personally love the Horizon app because you can actually save a digital copy of your ID card in case you forget your wallet at home. With that said, that really brings us to the end of our presentation. I think the big takeaways for today is that May 30th deadline to make sure that you get in any changes or enrollments into Carrie. Definitely feel free to reach out to us. We have our phone number and our email address on the screen. Carrie, Nancy, is there anything else that you'd like to add before we wrap up today?
I think that's it. I think you covered it all. Thank you very much.
Excellent. I highly encourage everyone to reach out with any questions about their benefits, their utilization, so we can help answer that for you. And I thank everyone for their time today. Have a great rest of your day.